Aspirin, used in the prevention of heart attacks, is probably the most cost-effective drug available in medical practice, and daily low-dose aspirin is now a standard item in the management of heart disease patients. There is evidence that aspirin taken during a heart attack can reduce the size of the clot causing the heart attack and may even cause the platelets in the clot to disperse. Research shows that the death rate can be reduced by 20 to 25%. Aspirin also has effects on processes other than clotting, suggesting that if taken very early in a heart attack, the damage to the heart could be reduced and additional lives saved. Patients with a known risk of heart attacks, including all people over the age of 50, would be well advised to carry a few tablets of aspirin at all times and chew and swallow the tablet immediately if they experience severe chest pain, even as they're phoning the 999. They are chewed rather than swallowed, as this means that they are absorbed twice as fast into the bloodstream, speeding up the treatment. Soluble aspirin should not be swallowed whole. Although aspirin will greatly benefit the patient, we cannot force them to take it. Instead, we offer it to them and tell them that it could help them. In the workplace, the HSE do accept that this is a valid time to offer medications to a patient. The problem can be carrying a packet of aspirin. It can be difficult to carry. The tablets can get damaged or damp. If they get damaged or damp, this would render them useless. There is a solution to this. There's a new product available called the Aspod. The Aspod is a small keyring, and with what the keyring does, it actually holds the aspirin nice and safely inside. So what you do with the unit is you put it together, and then you can pop the aspirin tablets inside the Aspod, and they will stay there. The actual unit keeps the tablets nice and dry. There's lots of other benefits to the Aspod. To start with, it glows in the dark, so you can easily find it. You can clip it onto pretty much anything. There's a normal clip and also a G-type ring, which it fixes very easily onto handbags, belt loops, key rings, anything like that. And it's just keeping those aspirin with you at all time. Also, the Aspod's made of a day glow material, so very, very easy to find at night. You can personalize it by just turning it inside out on the main strap, and you can write your name and any contact information on there as well. So you've got your name and maybe a phone number to call. And also around the outside, it just confirms exactly what you need to do. Now, the Aspod is not a reason for not calling emergency services. If you suspect you're having a heart attack or a patient's having a heart attack, then we must make sure that we call emergency services straight away. With the aspirin inside, you're going to need to change them because ultimately they may well get a little bit damaged inside here. So it's good practice every 6 months to open the packet up again, pop new ones in. You can go onto the Aspod website at www.aspod.co.uk and you can register there, and the system will then email you to say that it's time now to change over the tablets. If you're interested in buying Aspod, it's available in lots of shops, or you can just go onto the store on our website to click on the link at the top of the page that says store, and you can buy them straight away and we can get those out to you in just a few days. It's ideal to carry this type of thing at all times and make sure that all your family members carry them as well.